Alcohol, ethanol, blood test. 1. Introduction. Alcohol consumption is common worldwide, but excessive or inappropriate use can impair judgment, motor skills, and consciousness, posing health and safety risks. The alcohol, ethanol, blood test is one of the most accurate methods for detecting and quantifying alcohol in the bloodstream. In medical settings, it helps assess patients with altered mental status, accidents, poisoning, or suspected alcohol-related illness. In legal and forensic settings, it provides evidence in cases such as driving under the influence, DUI, workplace safety violations, or criminal investigations. The test is important because alcohol affects individuals differently depending on factors like body weight, gender, tolerance, and metabolism. Definition. The alcohol ethanol blood test is a quantitative laboratory analysis that measures the concentration of ethanol circulating in a person's blood. It is typically reported in milligrams per deciliter, milligrams per deciliter, G per del, grams per deciliter, percent BSE, blood alcohol concentration. Example, 80 milligrams per deciliter equals 0.08 prank. Presents. Indications. The test is indicated in multiple situations. Medical indications: unconscious or unresponsive patient with unknown cause. Symptoms of alcohol intoxication: slurred speech, unsteady gait, vomiting, confusion. Suspected alcohol poisoning, e.g. after binge drinking. Monitoring alcohol withdrawal or abstinence during treatment. Legal forensic indications: suspected drunk driving. Post-accident investigations. Workplace safety compliance testing. Criminal cases involving alcohol use, e.g. assaults. HADA 4. Used for. Diagnostic tool to confirm alcohol as the cause of altered consciousness. Therapeutic guide. Helps decide treatment like IV fluids, airway support, or antidotes. Medical legal documentation provides evidence of alcohol levels in legal disputes. Rehabilitation monitoring detects relapse in patients undergoing treatment for alcohol use disorder. 5. Why do need of this test? To confirm whether alcohol is responsible for symptoms such as dizziness, nausea, confusion, aggression, or unconsciousness. To determine if an individual is legally intoxicated and impaired for driving or operating machinery. To differentiate alcohol-related unconsciousness from other conditions like stroke, seizure, hypoglycemia, or drug overdose. To prevent serious complications such as aspiration, respiratory arrest, hypothermia, or death. Number 6. What happens during test? Procedure. 1. The healthcare professional cleans the skin at the puncture site, usually arm vein. 2. A sterile needle is inserted to draw blood into a test tube. 3. The sample is labeled and sent to the laboratory. Laboratory analysis methods: enzymatic assays, alcohol dehydrogenase method. Gas chromatography GC, gold standard for forensic use, spectrophotometry for hospital settings. Duration: sample collection takes only 2 to 3 minutes. SAPA 7, how long for my results? Emergency departments, within 30 to 60 minutes. Hospital labs, typically within 24 hours. Forensic confirmatory tests may take days to weeks due to strict protocols. 8. Prepare for this test. No special preparation is usually required. The patient should inform the healthcare provider of all medications, mouthwashes, or herbal remedies. Some contain alcohol. Avoid alcohol intake before the test if the purpose is medical assessment, unless testing for intoxication. Provide consent if used for legal forensic purposes. 9. Risks. To blood alcohol testing is safe, but minor risks include pain or stinging at the needle site, bruising or swelling, rare infection, lightheadedness or fainting. 10. Normal values: negative, normal, 0.0% BA. Legal intoxication limit varies by country. USA, UK, 0.08% bag, 80 milliliters. Some countries, 0.02 to 0.05% bag. Clinical ranges, 20 to 50 milligrams, 0.02.05%, mild effects, relaxation, euphoria. 50 to 100 milligrams per 0.1%, impaired judgment, reduced reflexes. 100 to 200 milligrams, 0.2%, slurred speech, poor coordination. 200 to 300 grams per deciliter, 0.3%, confusion, vomiting, blackouts. 300 to 400 milligrams, 0.40%, coma, respiratory depression. 400 milligram, 40%, potentially fatal. Interpretation results: 0.00%, no alcohol detected. 0.01.5%, possibly impaired, varies by tolerance. 0.08% and above, Legally intoxicated, not safe for driving. 0.20% severe impairment, risk of injury for a percent, high risk of coma or death. 0.40%, often fatal without immediate intervention. Chapter 12. Factors affecting results. Timing. Alcohol metabolizes at 15 to 20 milligrams per hour. Body weight and gender. Women often show higher BIN for the same intake. Food intake. Alcohol is absorbed more slowly on a full stomach. Medication substances. Certain drugs or alcohol-containing syrups may falsely elevate results. Liver function. Impaired metabolism in cirrhosis or hepatitis increases BAC. Tolerance. Chronic drinkers may function at back levels that would incapacitate others. Number 13. Clinical significance. Emergency medicine guides treatment in overdose and poisoning. Forensic science provides strong legal evidence in DUI and crime cases. Psychiatry addiction medicine helps monitor relapse or adherence in alcohol use disorder. Public health used in occupational safety programs and accident prevention. Internal medicine differentiates alcohol intoxication from other medical causes of altered consciousness. 14. Know more. Alternatives. Breathalyzer and urine tests are less accurate but faster. Ethanol versus other alcohols. Methanol and isopropanol poisoning require different tests. Tolerance factor. A chronic alcoholic may appear less impaired despite high BAC. Legal note. In some places, refusal to take this test can have legal consequences. Suspension of driving license. Hannah 15. Conclusion. The alcohol ethanol blood test is an essential diagnostic and legal tool for determining alcohol levels in the bloodstream. It helps doctors manage emergencies, supports legal investigations, and ensures safety in society. While generally safe and reliable, results must be interpreted carefully considering metabolism, tolerance, and timing of alcohol intake. Accurate testing helps prevent complications, provides justice in legal cases, and supports treatment in alcohol use disorder. Thank you. Have a nice day.